At the AutismOne conference in Chicago this year, I had a chance to sit down with Dr. David Holmes. He's the longest-standing chairman on the panel of professional advisors of the Autism Society of America and host of the international radio show, Adults on the Autism Spectrum Today, on AutismOne Radio. Through the interview, he shares advice for parents and educators of those on the spectrum and stressed the importance of life skills as a key to success.
When I always challenge teachers, I say, well, what are you really ultimately teaching? And they'll say, well, I'm trying to teach math and logical thinking and so forth. And what I'm trying to do right now is get teachers, especially special educators, to say that I'm teaching life skills. I'm teaching individuals to have the capacity to be responsible and independent members of society. The whole reason for our educational system, our founding fathers put this together, not to get kids off the street, but to prepare them for the adult world so they can become fully included members of adult society, which then makes for a better society. And our young people of autism, to be quite frank, are ill-prepared for the adult world.
The transitional IEP is of paramount importance for the transition from school setting to real world and needs to be considered early on.
By the time a child reaches high school, federal law is very clear, and it says that there should be a transition IEP in place. Transition IEP no later than their 16th birthday. Now, no later than their 16th birthday does not mean 16th birthday. It can mean 12, 11, 10. It can mean 2, to be quite frank. But typically we would like to say by the time the child's 12, 13, or 14, early adolescence, that a transition plan should be put into place for the adult world. This is generally, when it does occur, is done in isolation. It does not include the adult service providers. And so we find teachers sitting around the table talking about what the transition plan is going to be. And because most of the IEP format, the protocols, call for rehab, divisions of developmental disabilities, and MR to be at the table, they'll say, these are the contact numbers for these individuals, but they rarely, if ever, have them at the table. So educators are ill-prepared to design programming for the adult world because that's not what their training is. So they've got to bring, moms and dads should demand that people that represent adult services in their respective states sit at the table during the transition IEP because the law is very clear that they should be there. These are the individuals that then can help mold and guide and direct the educators in terms of the goals and objectives for that transition IEP.
Parents have a responsibility regarding their kids' education and the contract that is an IEP.
Every parent that I know and every individual, even the adults that have services, has a case manager. And oftentimes it's a case manager in name only. And I will tell you, and I've told this to mostly moms, but I would like to see dads as well involved in that. I always tell the moms, I said, you are the child's case manager. And moms especially, or dads, but moms usually are the principal individuals. You have to be the ones that are going to make certain that your son gets what he should be getting, and actually what the IEP says he's supposed to be getting. People don't understand that the IEP is a contract. They just don't get it. Educators don't get it. They think it's just something that we're supposed to do on an annual basis. It is a contract. And if, for example, if you go out and buy something and you have a contract for that product and it doesn't come through, do you sit back and say, well, that's okay? Or do you say, no, wait a minute. You broke the contract. I want a refund. And that's what we try to do. In fact, when we end up going to court, we will fight with school districts and even look for compensatory education. If they don't meet the goals and objectives, then they have broken the contract.
Finally, Dr. Holmes helped write the book, Rehabilitation for Individuals on the Autism Spectrum, and it's available to you.
It's a book that was recently published, and it's vocational rehabilitation for individuals with autism spectrum disorder. And it's published actually by the Office of Special Education and Rehab Services, and it's the Rehab Services Division that's publishing it. You can get the book at www.gwu.edu/tilde, and the tilde is that little squiggly line in the upper left corner of the keyboard, CRCRE. Again, it's www.gwu.edu/tilde CRCRE. When you get on that website, you can scroll down on the left side to the 30-second IRI, and you'll see the book there. You can either download it or you can pay $10 and it'll be mailed to you. I recommend you pay the $10 because it's a pretty thick book.
In closing, please advocate for our kids on the spectrum by knowing the law, acting as case manager for your kid, and take advantage of the resources available to you. For Autism Hangout, I'm Mark Wirbel.